What inspires change? What motivates us? It's what's inside that moves us. What moves you? Get the Scion story at Scion.com.
There may be a nationwide shortage of PPD skin tests, but the General Services Agency has procured 1,300 of the 1,900 TB test kits that are needed by the Department of Public Health to accommodate students entering the Department of Education school system. GSA Chief Procurement Officer Claudia Ekfaji says her office began looking for a new supplier as soon as they learned that the shortage was affecting Public Health's order, and MD Wholesalers was the only supplier that could deliver test kits by the end of this week.
The 600 we haven't procured yet,
Okay.
but the 1,300 is already ordered, and the 600 is, we're just waiting for a letter of commitment from MD to say that they are able to deliver the 600 by the end of this week. So that'll wrap up the 1,900.
Senator Dennis Rodriguez says that if all the test kits have been procured by tomorrow, he'll withdraw his bill that would have suspended the requirement.
If we get enough testing kits that they're anticipating for at least the school students that need it, then there won't be a need at this point to temporarily suspend the TB screening requirements.
Rodriguez's bill is up for a public hearing tomorrow evening. It will be canceled if the bill is withdrawn, but Rodriguez says the dialogue about tuberculosis screening at DOE will continue.
I've committed to Public Health that we would have a community discussion for the long term, because Public Health has said that we need to revisit the way we do our mass TB screenings. As you know, CDC has come out with guidelines recommending a change in the way TB screening is done. And so I've told them that we would have these discussions, and perhaps if something is put into place, then the community would have much more time to get educated about these new guidelines moving forward.
Meanwhile, Public Health and the Department of Education will be offering tuberculosis screening at the Micronesia Mall on Tuesday and Wednesday from 10 a.m. to noon. The screening is only for kindergartners and new public school students who are under the medically indigent program, Medicaid, or are uninsured. Parents are asked to accompany their children and to bring their child's shot record and a photo ID. Those screened will have to return to the mall 48 hours later to have their results read. Ekfaji is happy her agency was able to locate the test kits needed to offer the screening, but she says the issue could have been resolved at a lower cost if Public Health had let GSA know about the shortage more quickly.
GSA wasn't informed in a timely manner so that we can actually make arrangements to take whatever measures that we had to do to meet the opening of the school to vaccinate these kids. And I guess that was the situation. But we resolved that by having to, of course, spend a little more money. Had we known earlier, maybe there was a way to avoid this crisis.
Betsy Brown, PNC News.